Hello everybody, my name is John Perry and today I will be doing my research presentation on limiting your children's access to prescription ADHD medication. Now I want to start off this presentation by talking about the different types of options, some background knowledge. I believe everyone needs to be informed on the different options for medications that they could give to their child before making a decision. Alright, stimulant medications are the most commonly prescribed ADHD medications, treating 70 to 80% of the children diagnosed with ADHD. Stimulants consist of methylphenidate medications such as Ritalin and Focalin, and the more commonly known amphetamine medications such as Adderall and Vyvanse. Now, stimulant medications work by targeting a certain brain chemical called dopamine, and dopamine plays a critical role in producing motivation in the human brain. The other option is non-stimulant medications. They can also be used, but they are nowhere near as effective, taking upwards of a month to start showing results, while stimulant medications take roughly 30 to 90 minutes within ingesting to start showing results. Non-stimulant medications are mainly used to treat high blood pressure in adults. However, they are also sometimes used to treat ADHD in patients who have previously experienced negative effects from stimulant medications. Now that brings me to the second point I want to discuss, which is what are some of the side effects that you can experience from taking these medications. Now the first one is lack of hunger. One of the main side effects that people with ADHD report from taking ADHD medication is loss of appetite. This can lead to unhealthy weight loss as well as possible dizziness from malnourishment. Now, the second one I wish to discuss is sleep loss. Prescription ADHD medications mostly consist of stimulants, meaning that they can increase your heart rate. Now, this increase in heart rate can lead to the patient not being able to fall asleep at night, therefore disturbing their sleep cycle. And the third side effect I want to talk about is more of a health risk, which is cardiovascular risks. In an advisory sent out by the FDA in 2008, the FDA expressed their concerns related to ADHD medications, claiming that there can be severe cardiovascular risks tied to these medications. Now, that shows that anyone without a prescription to these medications definitely should not be taking them. If people who are prescribed these medications, who actually need them, can suffer from these side effects, there's no reason that people who are not prescribed to take them and suffer these side effects. Now, the third point to discuss is how does access affect youth today? Now, studies show that the main factor that plays into medication abuse is access to them. With more prescriptions being given to younger people, it not only gives the youth who are being prescribed access to the medications, but it also gives youth who are not prescribed, who are around those prescribed, access to the medications. In a journal entry by Matthew Varga, he explores Adderall abuse on college campuses and investigates ways that Adderall is spread on campus. In his journal entry, Varga claims that one of the four major factors that plays into Adderall abuse is accessibility, and he follows up his claim by stating the increase in students coming to college with this medication allows for ready access. If someone has ready availability to something, they can get it whenever they want it. It gives them a much higher chance of overusing whatever they have access to. All right. Now, the fourth point is other means of access. Though youth gaining access to the medication through their peers has already been discussed, there are other methods youth use to gain access to these prescription ADHD medications. Now, the first and main way is prescription access. This is the way that it should be done. The main way that youth gain access to this medication is through a prescription by their doctor. Now, that even though this is the correct way, this is not the only way people use to gain access to the medications. The second one that I'm going to talk about is the biggest and probably most threatening one, which is internet access. The internet is a growing concern when it comes to access to prescription medication. Youth today can have prescription ADHD medications shipped straight to their front door with minimal to no effort. This is making the internet a more powerful drug dealer than any street dealer, as you can not even leave your house and gain access to these medications. Thank you.